Hi there, I'm Robin Morrison with the Dental Consultant Connection, and we're here today with our video series, Empowering Dentists as They Navigate a Crisis. And today I'm so excited to introduce our guest. We have Leslie Canham with us, and her title today is What Dental Professionals Need to Know About COVID-19. So important. So I want to tell you a little bit about Leslie, and then we'll let her get started. Leslie is a speaker and consultant specializing in infection control, OSHA compliance, Dental Practice Act, HIPAA regulations, and a variety of subjects surrounding accommodating and treating special needs patients and patients living with HIV and AIDS. Leslie is a certified speaking professional and lectures nationally and internationally. With over 48 years of experience, Leslie provides in-office training, audits, mock inspections, consulting, and webinars. Leslie is frequently called upon to investigate breaches of governmental agencies and the private sector. She is also authorized by the Department of Labor as an OSHA outreach trainer. Welcome, Leslie. So happy to have you join us today.
Thank you for inviting me, Robin. And what a timely topic. With COVID-19 here, there's a lot that is changing as far as what we need to know about infection control in dentistry today. And my main concern is really that dental professionals have access to the right resources so that they can keep themselves informed of what they need to do. And everyone seems to have questions, really good questions today, where we may not have answers until tomorrow. So just to give you a little background of my expertise when it comes to infection control, I've actually been doing this for over 20 years now, outside of my experience working in a dental office clinically and also at front office. But when I started lecturing on infection control, I think most people thought when I said the word infection control, that what I meant was wound management or properly prescribing antibiotics. And these are people who are outside of dentistry. But I think today, there isn't anyone that doesn't understand the word infection control. Now, we in dentistry know that that means it's a certain set of steps that we take to prevent infection transmission, including standard precautions and hand hygiene and PPE and appropriate surface disinfectants and appropriate use of sterilizing instruments. But today, that word has been heard every single day and is in every single living room. So what that means for us in dentistry is that we're going to have to be at the top of our game when we resume to the practice of delivering safe dental care to our patients on a routine basis. Some of us have to see patients for emergency. And it's difficult with not knowing if we're protecting ourselves when we see the patient or whether we could be potentially at risk. And so there are guidance for us in dentistry for those who have to see emergency patients, both on the American Dental Association website. In fact, they just updated it yesterday. And then Centers for Disease Control has interim guidance for us on how to manage our emergency patients during this pandemic, and they just updated that a few days ago as well. So I want everybody to know that your first two trusted resources would be the American Dental Association website, ada.org, and then Centers for Disease Control, CDC.org, CDC.gov for government, CDC.gov. I'll also recommend another resource so I don't forget it before our time is up today, and that's OSAP, the Organization for Safety, Asepsis, and Prevention. And OSAP, their website is www.osap.org. They have made their website open to dental professionals. Anyone in the world can log in and access their COVID-19 resources. And their resources are actually links to all that I mentioned already, plus EPA for looking up disinfectants, plus World Health Organization. There's about, I think, 10 or 12 different websites that are, again, trusted resources where dental professionals can to get good, up-to-date, ever-changing information. I think another thing that's important to realize, besides that we're going to be looking at and facing some changes in infection control, is that we're going to be looking at personal protective equipment. And I don't know, because I don't have a crystal ball, as to what that's going to be. But I can tell you that as of today, and again, everything that I say is as of today, because tomorrow this may change, because it changed from earlier this week, and I'm constantly updating my presentations to meet what is the most current. So it's a daily task to check in multiple times of a day. And then that includes with White House briefings as well, and state and local requirements too. But with PPE right now, we're finding that I think the biggest question that I have over the last 30 days is we don't have N95 respirators. Can we see our emergency patients if we don't have them? And the proper answer really, based on all the information, is no. Don't take the chance. Patients may be infected with COVID and be asymptomatic. And the new science shows that it may not just be droplets that we are exposed to. It could be aerosols, which contain the droplets or turn into droplets and fall out, but they remain suspended. And we don't know, the science isn't clear on how long. And I know I've seen some documents that state, like, for instance, the National Institute of Health published on March 17th, that these aerosols may be suspended for 3 hours at a time. And then I've heard other reports from Dr. Anthony Fauci, when I see him on the various programs that he presents on, that these droplets or aerosols are short-lived in the air. But the one thing that I think is the consensus of all the experts is that these droplets can be, or these aerosols can be expelled from a patient's oral cavity when they're talking or breathing. And it doesn't have to be actual treatment that aerosolizes. So
Wow.
I think we'll see changes in personal protective equipment. And I would encourage everyone to stick with the ADA and the CDC guidance, the interim guidance for right now on how to protect themselves. And of course, I'm hoping that everybody is only looking at seeing emergency patients, because we put ourselves and we put our patients and our staff at risk at this moment in time. So another thing I think that I've been getting a lot of, well, I guess what's been getting a lot of airplay is hand hygiene. You know, who doesn't hear about that? And, you know, I've been following pandemics for these last 20 years as I've been consulting and speaking on infection control. And we had our SARS outbreak, you know, early on, about 18 years ago. And then about 11 years ago, we had swine flu pandemic. And when swine flu pandemic hit, you know, of course, it didn't take our country by storm like COVID-19 is. But we got guidance to stay home when we were sick, to use alcohol hand sanitizers or wash our hands frequently, to make sure that we stayed away from other people who were sick. And I think our general population, not just our dental population, but our general population got a big education on hand hygiene, another new word that has been now introduced to the public's consciousness, where we've been acquainted with hand hygiene for a long time. And of course, you know, being conscious of how we cough or sneeze. Cough etiquette is what it's called. So 11 years ago, we were seeing in hospital settings and in dental offices and medical and pediatric clinics all over, we would see the hand sanitizer stand along with the tissue and wastebasket. And then sometimes there was a box of masks, so that if someone came to the facility and was actually coughing and sneezing, they could cover their cough or sneeze. So we got a good education there. And I think mostly Americans followed that guidance at that time. And then we had Middle Eastern Respiratory Syndrome, MERS. You may remember hearing about that. And then we had our Ebola outbreak, which was a very small number of individuals in the United States who actually became infected with Ebola. But at that time, the American Dental Association gave guidance to dental practices to screen their patients, particularly asking them if they had traveled out of the country in the last 2 weeks. And so at that time, while we only had really just, I think I could count on one hand how many people became infected with Ebola as a result of that in the United States. It was interesting because this story that really kind of set off the whole thing, the news story, was centered around Dallas in a hospital where a health worker who helped care for Ebola patients in West Africa. His name was Thomas Eric Duncan. He traveled to the United States, didn't feel so well, went to the hospital with his symptoms. And of course, at that time, they really weren't looking for Ebola. But anyway, they treated him and sent him home. It ended up that he died later that night. And he lived in an apartment with several other people. There was even children who were grade school children. And so he may have exposed them as well. He ended up exposing a couple of the nurses who treated him at the hospital, and they became infected with Ebola. So we had a guidance around the entire country to screen our patients for a short period of time for Ebola. I think today, now that we have our COVID-19, we're probably going to be looking at screening our patients as well, and rightfully so, because in general, people should not come to the dentist when they're sick. And actually, I think our patients take care of that for us a lot of the time, because if they don't feel well, if they are coughing, if they can't breathe through their nose, it's very hard for them to hold their mouth open for dentistry. And it's also very hard for us to work on them if they're not feeling well. Mm-hmm. So fortunately, our patients seem to self-monitor and will call in when they're not feeling well. But we also need to take a look at what the new guidance will be. Perhaps it will be a question on the telephone when we confirm, or if we use one of the automated systems for confirming, perhaps that text message might include a brief, a few questions about screening, and please call us regarding your appointment if you're running a fever, or if you've taken any kind of medications that reduce fever, aspirin or Tylenol or anything like that, because we may even be looking at perhaps taking their temperature when they come in. And if they've taken something to reduce fever, then we would need to know that. And
yeah, Linda Harvey and I were talking about that. And, we both kind of think most practices will be taking temperatures, but that we did bring up that, what if they take Advil or Tylenol or something to reduce the fever?
That's right. So there's a lot to think of, and I think we should be paying close attention to the recommendation from CDC, from OSHAP, and of course ADA, as to what our direction should be and what our script should be for patients as well. Because we are healthcare providers and we are professionals, and we should have a united front on this. Now, of course, there will be people who have no symptoms that come in, and that's where our standard precautions must be elevated, so that we are looking at more protection, maybe respiratory protection, that is elevated in our new normal of what we're going to see as we go forward back to working on patients again. And so that leads me to personal protective equipment. Early in March, the biggest question that came across my desk was, what if we run out of PPE?
That's what I wonder. Is it going to be hard to get too, right?
And another term, I used to have to say, PPE stands for personal protective equipment. But you know what? I think that 99% of the world knows what the acronym PPE is, and so we may have shortages. But having our offices closed and having our stay at home in I guess it's almost every state. It may not be in all states, but that's going to help our supply to maybe either be redirected where it's needed the most to the frontline health workers, or maybe even be replenished, give a chance for the manufacturers to ramp up. And then my next question that I got was, well, if we can't get PPE, can we sterilize our masks, or can we use the same mask all day? And the answer to that is no, you cannot. Your mask will lose efficacy if it's sterilized, let's say in a steam sterilizer. The moisture is going to weaken the barrier, and the heat may even have an effect on the elastic ties that you hold the mask firmly to your face with. the recommendations that I'm seeing most frequently coming from the trusted resources are, at this time, of course, an N95 mask or respirator, which are in short supply or unable to order. And so again, for emergency patients, an N95. But I believe what we're going to be seeing is when we go back to the business of providing safe dental care to patients again, that we'll be looking at the higher level mask, like a level mask, along with a chin length plastic face shield. So going forward, again, I have no crystal ball, but that's the best that I can see happening. And for the interim, patients who need to be seen by a dentist, I'm hoping that the dentist will not take the chance of exposing the staff. I hope the dentist will take extra steps to prevent exposure to themselves, because, you know, whether they're a vulnerable population or not, still, COVID, I don't think the virus cares much, you know, who you are. So an N95 respirator, I'm hearing that today with some of the dentists who do have the N95 respirators, if they are in short supply, what they're doing to optimize their supply is putting a level 3 mask over that respirator and then changing that level 3 mask if they have to use that N95 respirator. Because, you know, if we're using a mask over and over again, we're not only not protecting ourselves well. A mask really has about an hour of time that you can breathe into it before it ceases working as a filter for you. But we're also not protecting our patients, because it's a wonderful place of cross-contamination. If you think about it, your mask and your hands are the closest things to the patient's mouth. And so it's great real estate for anything that they're exhaling to land on. And again, we talked about COVID being something that could come from the patient's mouth by breathing, you know, simply breathing and talking.
That's a good suggestion, though, if they had to put another mask over their N95.
Yeah. Again, there's interim guidance from Centers for Disease Control, and I hope that people will take a look at that and bring that into consideration during this pandemic and during the time where we're supposed to be seeing emergent patients only. Now, in addition to the PPE issue, another big question that comes up frequently is, how do we kill this? I mean, what do we do different with our surface disinfectants? And the answer is really, there's nothing different that we do with our surface disinfectants. A coronavirus there's about, I think, 5 or 6 different strains of coronavirus. And some of our disinfectants have already been labeled as effective against coronavirus. Another point I want to make about the virus itself is that this virus, while it can survive on surfaces for long periods of time, and there's still studies that are providing more and more evidence. It's like 4 hours on copper and something like 3 hours on plastic and stainless steel surfaces, 24 hours on cardboard. But for all intents and purposes, if this COVID-19 coronavirus behaves the same way as other coronaviruses, it's very easy to destruct with even a low-level disinfectant. So what we use to kill hepatitis and HIV and staph and strep and salmonella and herpes, these are all either intermediate or low-level disinfectants that cover the kill for those organisms. It's an envelope virus, and it's very easy to destruct with your simple disinfectants, even bleach and water. And so here again, we have our general public, people who aren't in dentistry, who are getting an education on disinfecting. Mm-hmm. They're even being told to disinfect their groceries, which I agree is a good idea, and to leave packages that are maybe cardboard, things that are not perishable, leave them for 24 hours so that you can kind of wait before you introduce them into your kitchen and into your cupboards. And interestingly enough, the household disinfectants that people are using that they can buy, if they can find it on the shelf, are what they are showing on television for people to be disinfecting their groceries. So you wipe down, they show, bring in your container of milk and set it on a countertop that is considered your contaminated side, or put something down like newspaper and set it on that. And then they say disinfect it and then move it over to a clean side and then let it sit for, I guess, the surface contact time. So our patients are getting an education on the mechanics of appropriately disinfecting surfaces. And unfortunately, they're still not getting the information about cross-contamination. As you've heard, many people are wearing gloves and masks, and they're touching things, go to the market and touching everything, and touching their wallets and touching their cell phones and touching their keys with the same gloves that they use to touch everything else. So they haven't, it's not easy. Actually, I pay close attention to what I touch when I wear gloves. And I've been out during my weekly market run or to my post office or banking, and I try to have one hand with a glove that I use to touch surfaces, public surfaces, or pump gas in my car, or open the door at the bank. And I have one hand that is a bare hand that I use for my own personal things, my own wallet, my own keys, my own cell phone. And it's not easy to not cross-contaminate. It's you have to think about it.
That's a good suggestion, though, to just do a glove on one hand.
Yeah. And of course, alcohol hand sanitizer, as soon as I'm finished, and washing hands. And so in moving on to us as dental professionals, we need to be staying closely connected to the trusted resources for guidance on what we should be doing and how we should be doing it and with what product. The EPA, Environmental Protection Agency website, they've actually loosened up the regulations for manufacturers to submit their label claim on what it kills to show a product is effective against COVID-19, so that those items, those products can be listed more rapidly on the EPA website. And so I would encourage everyone to take a look at the EPA website. You may be able to identify your disinfectant that you're already using and that has a label claim either against coronavirus or specifically COVID-19. I'm keeping in mind that COVID-19 was only really identified in November, so that wasn't enough time for manufacturers to submit to EPA that the kill claim to put on labels. So they're going to step that up, and again, recognize that it's a virus that is it's one of the easiest of the viruses. It's the least resistant. I mean, you take something like bacterial spores, the most resistant thing to destruct, and you have to use heat sterilization or cold sterile. And then at the very other end of the spectrum, listed in the CDC guidelines for disinfectants on their table, the very least resistant is that coronavirus. So we can have
That's
some
good
confidence.
to know.
Yeah, that we're killing it pretty easily. I mean, even bleach in water, 1 part bleach to 5 parts water is a good disinfectant. 2 parts bleach to 5 parts water is tuberculocidal. And from what the chart is showing us is that the coronaviruses are low, they are destructed easily by low-level disinfectants.
Well, that probably could put some minds to ease a little bit, knowing that.
Right. So as we ramp back up into getting prepared for getting back to seeing patients, I believe that there's never been a better time to really just concentrate on your team training. If your team is still being paid, or maybe bring them back in to be paid, conduct your OSHA training, conduct your infection control training, take the CDC interim guidance and have each person read that. Everyone can download that to their own devices. You can have a Zoom meeting together, you can have a FaceTime meeting, you can figure out a way to, even if it's a telephone conference, to get everybody in to have reviewed the material, and then each employee maybe give a book report of what they read and any fine points that they gleaned out of that, or what they haven't been doing that they need to be doing. And really to get not only your infection control while we're at home, while we're sheltering at home, you can still download the labels of your disinfectants you use to read them thoroughly and to make sure that everybody's using the products for the right amount of time according to the manufacturer's directions. You can take the CDC guidelines. There's a new one from 2016 that has a beautiful checklist, and a team of 5 people, for example, can go through the 22-page checklist and each take a couple or 3 pages and review that again, come back to the group and say, these are the things that we're doing well. These are the things that we really need to improve upon. Because infection control, again, has never been more important. And our patient population has never been more educated on simple things like the word infection control, hand hygiene, PPE, and disinfectants.
Right. Yeah. And I think too, I mean, that's a fabulous suggestion for the team to do that. And I think 2 things, I think the team's going to feel safer because they're going to know that their practice is implementing all the safety for not only their patients, but for them as well. And then they can get on the same page when they and consistently let patients know what they're doing in their practice to keep them safe. I think that's, I think patients are going to have a big concern when they come back into the practice. And I think letting them know that, letting them maybe do a tour in their office of their sterilization area. And this is what we're doing to keep our team and you safe every day. You know, I even hear that when I went into the grocery store yesterday and they were cleaning the belt where you put your food. And they said, we're cleaning this every 20 minutes. We want you to know that. And that, you know, just that's the grocery store reassuring us. So we really need to do a good job reassuring our patients.
That's right. And reassuring our patients, another thing you can practice as a team is your verbal skills. So you all have a united front on what you're saying and how you're saying it. Again, it will help to boost our confidence. When we're saying the right things, we're not searching or fishing or eyes up to the right or left, trying to figure out what to say. Our patients will feel more confident in our care. And, you know, you're right. It's going to be an avalanche. When we open the doors again, it's going to be so busy that it's going to be hard to focus on back to basics, back to the basic standard precautions with whatever elevation we have as our new normal.
Mm-hmm. Yeah, I agree. It'll be a little chaotic for them. So anything they can do as, you know, preparing for OSHA and other things, I mean, do it while you have the time, because it's going to be a different world when they go back.
That's right.
Yeah. Well, thank you so much. I know you're a busy lady. I know you're researching every day, 24 hours a day, but we need somebody to keep us up to speed on this. And I do hope that practices will do as you're saying and check back on these websites that have all the information. And like you said, the information's changing daily sometimes. So
that's great. And I'm available too if there's any need for some remote training. I'm doing webinars and I'm doing consulting and training right from my very own headquarters here. We call it the Situation Room at Camp Canham.
I did see that picture. I loved it. So how can people get in touch with you, Leslie, then if they have some questions or need some training?
Leslie, Leslie, at Leslie, Leslie, Canham, like a can of ham, CANHAM.com.
Okay, great. All right. Well, thank you so much. Stay safe. Stay well.
Thank you so much, Robin.